So the work on resilience led naturally to an effort to develop some kind of a positive action research in the form of a mental health promotion program. And the opportunity to do that came about because the Public Health Agency of Canada had a call for proposals in an innovations program. They announced this one summer. I came across the announcement. They actually listed our Aboriginal Mental Health Research Network as a resource to help people develop these proposals. So that was how I found out about it. Nobody ever contacted me and said, oh, you'll be a resource. So I said, okay, well, we should apply for this. And what they were asking for were projects that would do implementation research, which is an emerging idea where you would focus not on proving that something works, but taking something that is supposed to work, because there's some other evidence, and figuring out how can it be implemented and what are the facilitators and the barriers to implementing. So this is a kind of new domain, kind of usually beginning with an evidence-based intervention and then studying how can it be scaled up and so on. We were helped in being able to respond on very short notice. Again, as I say, it was like there was a month or two between when this was announced and applying, because I had been in conversation with an American sociologist, Les Whitbeck, who had been working with Anishinaabe communities in Canada for a long time, and trying to develop. Originally doing similar work in terms of looking at risk and protective factors and so on, but then trying to develop an intervention program based on something called Strengthening Families. And Strengthening Families was a family intervention program designed for young people, pre-adolescent youth, to promote drug prevention, part of the sort of, whatever, war on drugs in the United States. And the idea was to help these kids to improve family communication, improve warmth and support in the family, and monitoring of how kids were doing, and give the kids some skills, refusal skills. So if somebody said, here, try this, they could say no thanks, and so on. And so that was the model. And Les had been working they had developed an Indigenous version of this. So we made a proposal to the Public Health Agency of Canada that we would he would be our partner, and we would bring other partners in, and we would develop a way for communities to develop their own cultural version. So the focus was on cultural localization in a sense, because as you know, we have many, many different Indigenous groups, First Nations groups. They get lumped together and all called Indigenous, but they're not one culture any more than Italians and Chinese are one culture. So there's a problem with that lumping together, even though people have to do it for political reasons and so on, and they certainly share a common thing. But when you throw them together, you emphasize what they have in common, and frankly, the biggest thing they have in common is the experience of colonization. So it sort of distorts the picture as to what they might want to emphasize in their own account. So that was the goal, and the way we set it up was by finding partners across the country who, we used our network. We had like 700 people on this mails list, so we could just say who's interested, and we found people who already had good connections with a community. So Raven Sinclair in Saskatchewan was working with the Swepmec community in central BC. And so on. So Jitender Serene was working, who's the head of Psychiatry now in Manitoba, was working with the Swampy Cree in northern Manitoba. So in each case, I went to visit and met with people in the community, and we talked about how we would do this. We got a large grant in the end, and we were able to support each community in taking this model of, okay, here's a 14-session, 2-hour-a-week thing where families come together, they have a meal together, the youth go off and do some things, the parents do some things, and then they come together again, and then they have homework, and they learn about their culture, they learn about mental health strategies, and so on and so forth. So we were able to do this project with this funding eventually in 14 different communities across Canada. There are many different versions that were developed and so on, and we're still Working on this, we received some funding from a private foundation, from the Pathy Family Foundations, who were able eventually to keep this going for a while. So it's been 8 or 9 years now that we've had some activity along these lines. And in the process, I've learned a lot, I think, about what culture means to Indigenous communities, what adaptation means. And for many of these communities, having the opportunity to think about their own well-being, their own identity through this process of teaching young people has been a very significant activity. Although there's definitely a long-term goal that this should have some impact on suicide, it's really framed as a positive mental health promotion program. And we redid many aspects of, for example, the substance use component of it focused, as I mentioned earlier, on refusal skills. This goes back to an old approach. And we instead developed with one of my actually current doctoral student in anthropology, Eli Shiner, developed, who's very interested in substance use and the anthropology of addictions. We developed an approach of a board game in which you pick a card and it describes a certain use of substances. Like my Aunt Mary likes to have a little bit of sherry in a teacup, in late the afternoon. And the point of the game is you then have to try to convince other people that it's either an appropriate or inappropriate use of substances. So rather than saying all substances are bad, which doesn't make sense to Indigenous people since tobacco is a sacred medicine and there are many other things depending on the tradition that people have used or continue to use. And even, I guess, to general society, people would say, well, if you're saying all alcohol is always bad, you're kind of contradicting our core culture and how we function. Never mind caffeine and whatever that I depend on for my entire survival at this point. Anyway, the point is it became a playful game that is much more about reasoning, about arguing, about thinking about these things with the idea that you can become a more sophisticated thinker about these. So this is one example of the many things that are built within this. And so it's been a very interesting process, and it speaks directly to the importance for Indigenous people of culture. I mean, one of the interesting things I talked earlier about how culture is taken for granted. In some of the other work I'll talk about later with migrant populations, if you talk about culture, people are not quite sure what you're talking about, or they assume you mean their ethnicity, and it gets framed in a very particular way. It leads to one of the things we have in Quebec, which is where we have cultural groups, as though we're not already, significant culture ourselves with our own dynamics. So, but interestingly, for Indigenous people, the word culture is very salient. It's because it was the explicit target of the colonial apparatus. It's what was damaged. It's what was forbidden. And so bringing that back, whether it means language or spirituality or ritual or ceremony or art, whatever it is for people, is very, very important. So this approach to mental health through culture, rather than as something separate that just floats above it, has been very interesting and meaningful to people. And we've learned a lot in these dialogues. I should say that one thing that happened with this network, because the network across Canada was made up of very interdisciplinary groups. So members of this network include, I mentioned Derek Culhane already, Adrian Tanner, Jim Waldron. So some of the leading sort of medical and psychological anthropologists, even cultural anthropologists across Canada who work with Indigenous people, as well as other people like Michael Chandler, who's a developmental psychologist who became interested in Indigenous health and who ended up, at one point I was putting together an issue of our journal, Transcultural Psychiatry, on suicide, and I contacted him because I'd read some interesting things about him on suicide, about continuity of identity or lack of continuity of identity as a vulnerability factor for suicide. So I contacted him to see if he had anything to contribute to the journal, and it turned out he had just completed a study in which he compared rates of suicide in different communities in British Columbia and correlated that with their own what he called cultural continuity, which mainly were measures of local control. Do you control your own police and fire station? Do you control your own educational system? Do you have a cultural center? And what he found was communities that had all those positive aspects of maintaining or their own autonomy and control and culture had almost no suicides. And communities that had none of them had astronomically high rates of suicide. So this has gone on to be probably the most cited paper in Indigenous mental health published in our journal. Because of this correlation between a community level process that's very political and very much about social transformation and a key indicator of mental health, in this case the suicide rate. So all of these people in this network contributed to a book that we edited. I should say that the network was configured in a way that we really wanted to have Indigenous leadership, and so Gail Guthrie-Valaskakis, an Indigenous scholar at Concordia University, agreed to partner with us. She was at the time the head of research for the Aboriginal Healing Foundation. And the Aboriginal Healing Foundation, which have been given funds to try to support community activities related to healing the wounds of the residential school system and so on, the legacy of that, was not mandated to do research. They could do a certain amount of limited, quality assurance or evaluation research internally, but they were not mandated to do research. So the idea was they formed a partnership with our network, and we would do the research. So we were able to do a number of interesting projects. Jim Waldrum coordinated a project where we looked at different healing projects that had gone on in different parts of the country. And we produced this book that Gail and I co-edited called Healing Traditions, the Mental Health of Aboriginal Peoples. And what's interesting about that book is it's not a manual for mental health practitioners. Rather, it's an interdisciplinary reflection on the relevance of the history of social sciences and other disciplines for thinking through the impact of culture and context on mental health. So the explicit aim of the book was to give people the background they needed to begin to think about these things, and hopefully to begin to think about how mental health care could be reconfigured. The last thing I'll say is that this network's goal really was to build capacity, to do some needed research to build capacity. We now are at a moment in time when there is a significant number of Indigenous researchers across Canada. I mentioned Carolyn Tate, Amy Bombay, Suzanne Stewart, a whole generation of younger people, Chris Mushquash. There are many, many people now who are excellent researchers in different domains, in psychology and anthropology and sociology, who themselves are Indigenous, who have a deep understanding of the needs, the dilemmas, and the ethics and the protocols that are appropriate for working with Indigenous communities. So I think we're really moving in a good direction. There's clearly a long way to go. And there are deeper problems that are involved that require thinking through the nature of pluralistic society, because we're in a moment where we're trying to reconcile. We've had a Truth and Reconciliation Commission. We're trying to compensate. Ron Neeson has written very eloquently in a book called Truth and Indignation about some of the dilemmas of the Truth and Reconciliation process, of what it sort of expects or demands from people. And the reality is that if we're going to live together with a high level of diversity and have epistemic justice in that context, that there's a lot to be thought through, a lot of dilemmas that are created by that. And most recently I've worked with Sarah Cohn-Fournier, a psychiatrist with a background actually in oral history, looking at the dilemmas that have been created by our efforts to acknowledge the injustices, and in particular, we did some work on the bioethical issues that are raised by what happens when a young Indigenous person's family decides that they do not want to receive biomedical care. They want Indigenous healing instead. And this is not straightforward. If, in a current situation, if it was a Jehovah's Witness that said, I don't want my child to have a transfusion, if it was a life-saving transfusion, it's very likely that the state and the court would intervene and say, we're sorry, your child gets the transfusion because they will die otherwise. That has been the principle of the best interest of the child has been the way many of these things have been decided recently. But the cases we discussed, the decisions were different because of taking Indigenous rights seriously. And whether that's ideal or not, what the complexities are of that whole situation, I think lays out a whole set of complicated issues that we need very fine-grained analysis from many disciplines, from legal anthropology, from bioethics, and so on. And in particular, I think it's another arena where having a more systemic view, seeing all the pieces that are interconnected, is terribly important, because otherwise we sometimes frame these things only as an issue of principles. and don't see that what's actually going on is a complex web of relationships and injuries that happen sometimes because people are experiencing racism, or they're not being listened to, or their autonomy is not being respected. And if we try to solve those things only by enunciating a principle, we may miss the actual dynamics where things need to happen. So for me, this is where systems thinking on the one hand and participant observation, that the traditional tools of anthropology, of being there, of seeing what's happening, are vital. Otherwise, we end up with a very incomplete picture and perhaps an incomplete or even harmful solution. So I think there's a lot of work to be done in these areas if we're sincere about not just simply respecting people by letting them do whatever they want, but by respecting people by building a community in which we're in genuine dialogue and we're helping each other with the best that we have available.